Hello, dear viewers. Welcome to my YouTube channel. I'm called Justice, your choice midwife. Today, I'll be bringing to your knowledge some tips on how to confirm if what you are carrying in your womb that we call pregnancy is a baby. So many ladies get pregnant with what we call a partial or a complete mole, but they don't know. Since any lady, when she just misses her period, she might start suspecting that she is pregnant. Once you suspect that you are pregnant, please, you are advised to go to the ultrasound unit and do an ecography to confirm if you are pregnant. That is the reason why I have chosen the topic. Use an ecography to confirm for pregnancy and not pregnancy test strips. Many people have been deceived that they are pregnant with a baby by the pregnancy test strip. The strip only indicates if there are pregnancy hormones in the body. We call the hormones pregnancy hormones because they only show up during pregnancy. Now you could be pregnant with something which is not a baby. During pregnancy, your body produces human chorionic gonadotrophic hormones, which now help also to indicate that this woman is pregnant and will have an influence on that pregnancy. But now, many women, once they miss their periods, they rush to any nearby pharmacy since the pregnancy test strip is cheap, readily available. They just go and get it, come back and do their urine test and confirm if they are pregnant. And when some even confirm, they never go for clinic. They don't even go for antenatal care, for checkup, and so on. They just stay at home, and according to them, they will only visit the hospital the day they are in labor. So today, I am coming to wipe away that mentality of using just the pregnancy test strip as a confirmation of pregnancy. If you think you are pregnant, do an ultrasound. The importance of an ultrasound is that it is authentic. That is the best thing said by WHO for us to use to confirm for pregnancy. Once you do an ecography, the very first thing an ecography shows is that you are pregnant with a baby. That's the very first thing an ecography will tell you. If it is not a baby, an ecography will show it. How will we know that it is a baby or it's not a baby? An ecography is going to give us the fetal heart rate or heartbeat. You will see the presence of a heart in the womb developing, telling you that what you are carrying actually is a baby and fetal material. But if it is a mole, it will show it clearly also that there is no heart present, which is an indication that that could be a mole developing. And now we would go for further investigations to send to a laboratory to test the quantity of HCG hormones present in your system. Normal level of HCG hormones present in a woman who is carrying a baby ranges from 20,000 to 200,000 international units per liter of blood in her body. But if it is a molar pregnancy, you will get to see that you have escalating amounts of HCG hormones in the body. They will be in excess, such as in a molar pregnancy, it begins from 6,000 HCG hormones right up to 8,000 HCG hormones, which is an abnormal level of HCG hormones in the body. It indicates an abnormality which should be further investigated. So I am here to tell you that do your ecography. It is not too expensive. Many women, even after going to the hospital to do their antenatal clinics, they don't even bother about ultrasounds. When you even send them, go, madam, go and do your first trimester ecography. Since you have palpated them, you say, no, what I can feel is there's a mass, there's something in the and so on. They will not even go for it. Most of them will use that money for shopping. They will buy their clothes or baby's clothes, or they will buy some nice things they will love to eat during antenatal care. But what I'm telling you is that the person you are risking at that point is yourself and no one else. So please, if you like this video, please leave a like, put a comment there for anything you've not understood. I'll address it later. And don't forget to click the notification button so that once I drop any video, you'll get to know about it and you'll get to learn more from me. Please, we keep encouraging you that please, if you think you are pregnant, the first test you are allowed to run is going to be an ecography. That is the best we recommend for everybody. An ecography will help you to know if what you are carrying is what you want to carry. Yes, no man wants to carry a mass of tissue. A mole is a mass of tissue growing in your uterus, and each month passes, a mole increases in size. So the size of the tummy keeps increasing, just as in pregnancy. It keeps increasing and increasing until when you get now to the labor room to give birth, and you realize that what you have given birth to is not a baby. And no woman wants to carry that. No woman wants to do all that. So please take note. Go for your ecography. It is very important. It is very essential for you to know about your baby and yourself. We want to have a healthy mother and a healthy baby at the end of our 9 months course. Please, we want you to graduate with flying colors and not with tears. When you are crying, we, the midwives, we cry alongside with you because it is not easy. It's not easy to go through that process for nothing. So please, every young girl out there, get me correctly. If you're pregnant, if that's the only thing you would do, maybe even for the first month, if you don't have money for another thing, go for an ecography first to confirm if what you're carrying is a baby or not. From there, you can begin to see what you will do next. Because if you don't know what you're carrying, it's needless doing any other thing about what you think you are carrying. Because every other effort will be wasted. So thank you for watching my video. Please don't forget to like, comment, share, and equally click the notification button so that when next I drop another video, you can get to see it and we get to learn more as days pass by. Thank you very much.